A 70-year-old man came to me recently, frustrated, ashamed, and confused. He said, "Doctor, I don't understand. I eat well, I walk daily, but when it's time to be intimate, nothing works." What I found shocked even me. His private habit, something he'd done for decades, was silently choking the blood flow to his penis. Not overnight, but drip by drip, year after year. I'm Dr. Mohit Khera, urologist and men's health expert with over 60 years of clinical insight into what truly keeps older men strong, vibrant, and intimately alive. Most men think masturbation is harmless, but after 60, certain normal habits can quietly damage nerves, restrict blood vessels, and ruin sexual function without you ever knowing why. In this video, I'll expose 4 masturbation secrets that slowly weaken your circulation and damage your intimacy, and I'll give you safer, smarter ways to protect your health. The first secret alone is something 90% of older men do, and it's one of the biggest reasons for silent vascular decline. Let's begin. Before we continue, if you're finding this eye-opening so far, go ahead and hit that subscribe button and turn on the bell. That way, you'll never miss another health insight designed to help you stay strong, intimate, and independent after 60. And if you're with me, drop a 1 in the comments to show your support, or a 0 if you think I can do better. Your feedback matters more than you know. Now, let's dive into the first secret. And this one is critical. It's a habit so common, so overlooked, that it's silently cutting off blood flow to the penis in millions of older men every single day. I call it the death grip. Secret 1. The death grip. How excessive pressure is killing your sensitivity and blood flow. This is one of the most common mistakes I see in older men, and one of the most damaging. They don't talk about it with their friends. They rarely bring it up in my office. But when the doors close and they finally open up, this habit comes out every time. Using too much pressure when masturbating. What's often called the death grip might sound harmless, even a little humorous, but the reality is far from funny. This habit is silently destroying the very blood vessels that keep your manhood alive. When you grip too tightly, especially over time, you're doing more than just overstimulating your nerves. You're actually compressing and damaging the small blood vessels inside the shaft of your penis. These vessels are fragile, especially after 60. The repeated strain causes micro tears and inflammation in the vascular tissue. Over time, the walls of these vessels begin to harden, reducing their ability to expand and carry blood. What you end up with is a slow, invisible form of strangulation. The arteries that once brought strong, healthy circulation now struggle to deliver enough blood for even a partial erection. And here's what most men don't realize. This loss doesn't happen overnight. It sneaks up on you. One day, you notice it takes longer to get aroused. Another day, you realize the feeling isn't quite the same. Eventually, the blood doesn't fill the chambers like it used to. You chalk it up to age, but that's not the full story. What's really happening is a slow breakdown of your vascular health caused by the way you've been stimulating yourself for years. I had a patient, 67 years old, who came in thinking he needed testosterone therapy, but when we looked deeper, his levels were fine. What we found was that he had developed scar-like thickening in the tissues surrounding his erectile chambers. The cause? Years of overly aggressive self-pleasure. It had literally reshaped his sexual function. And the worst part? It could have been avoided with just a little awareness. This kind of pressure doesn't just harm circulation, it deadens sensitivity. Nerve endings become less responsive, which leads men to squeeze even harder to feel something, continuing the cycle of damage. It affects more than your body. It chips away at your confidence, your intimacy, and your connection with your partner. You stop initiating. You pull away emotionally. The damage isn't just physical, it's deeply personal. If this sounds familiar, it's not too late. You can retrain your body, use a lighter touch, reconnect with sensation rather than force. And most importantly, respect what your body needs now, not what it used to tolerate decades ago. Treat your penis not like an object to conquer, but like a part of yourself that deserves care, attention, and patience. This one shift could be the difference between fading intimacy and revitalized connection. Now here's where it gets even more concerning. What if I told you that how you masturbate isn't the only danger? In fact, what you're not using during those private moments might be causing just as much harm. Most men skip it and pay a high price for that mistake. Let's talk about that next. Secret 2. Masturbating without lubrication. The silent skin killer. Let me ask you something most doctors won't. When was the last time you used lubrication during self-pleasure? For many men over 60, the answer is either never or I didn't think I needed to. And that's exactly where the danger begins. I want you to imagine something. Take your hand and rub it briskly across dry skin for 30 seconds. Feels irritating, right? Now imagine doing that to the most sensitive part of your body, where the skin is thinner, more fragile, and heavily reliant on delicate blood vessels and nerves to function. That's what happens every time you masturbate without lubrication. And while it may seem harmless in the moment, this dry friction is one of the most overlooked threats to male intimacy in old age. When you stimulate without lubrication, you're creating micro-tears in the penile skin. These tiny injuries may not bleed or sting, but they lead to long-term inflammation, scar tissue buildup, and the gradual tightening of capillary pathways that deliver oxygen-rich blood to the penis. Over time, these small traumas compound into something much bigger: restricted blood flow, reduced sensitivity, and a loss of fullness during erections. I've seen this firsthand with countless patients. One man, 72 years old, came in devastated by his declining intimacy. He said, "It's like my body just doesn't want to respond anymore." He wasn't diabetic, he didn't smoke, but when we examined the tissue, there was visible thinning of the skin and reduced elasticity, signs of prolonged microdamage. He'd been masturbating dry for over 40 years, never realizing he was slowly suffocating the very vessels that allowed him to feel pleasure in the first place. What scared him the most, and what I often have to explain gently, is that when scar tissue replaces soft tissue, the blood vessels can no longer expand the way they used to. That means less blood gets in, less stays in, and the sensation you once took for granted begins to vanish. Your body starts treating the area like a zone of trauma. The damage becomes structural, and structural problems are far harder to reverse. But it doesn't have to be that way. Something as simple as using a high-quality, water-based or silicone-based lubricant can dramatically reduce friction, protect the skin barrier, and preserve the integrity of your circulatory system. Think of it as preventative medicine. Just like wearing sunscreen protects your skin, lube protects your manhood. It's not just about comfort, it's about function, vitality, and preserving what matters most as you age. And if you've never used it before, that's okay. It's not too late to start now. Your body is still capable of healing and improving, if you give it the right conditions to do so. Respecting your body isn't weakness, it's wisdom. But here's something even more surprising. Even when men do everything else right, gentle grip, proper lubrication, how they position their body during these moments could still be quietly cutting off circulation without them realizing. And the effect? Just as dangerous. Let me show you what I mean. Secret 3. Poor posture. Why masturbating while sitting can cripple circulation. This might surprise you, but one of the most dangerous things you can do to your sexual health after 60 doesn't involve your hands, it involves your posture. In fact, I've seen men lose years of intimacy simply because of the way they sit. Most older men masturbate sitting down. It's convenient, it's private, and it's what they've always done. But over time, this one habit silently strangles circulation to the pelvic region. When you're seated, especially hunched over in a chair or curled up in bed, you're putting direct pressure on the perineum, the area between the anus and scrotum. What most don't realize is this is home to a critical network of arteries and nerves that feed blood to the penis. That pressure acts like a clamp, squeezing shut those tiny blood vessels and compressing the pudendal nerve. It's like trying to water your garden with a kinked hose. No matter how high the pressure, the flow gets blocked. This kind of postural compression doesn't cause pain, which is why it goes unnoticed for years. But silently, bit by bit, the tissue starves for oxygen, circulation slows, and sensation fades. I remember a man named Robert, 74, who came to me frustrated that even with medication, his erections felt numb and weak. We looked at everything: blood work, hormone levels, even cardiovascular function. But then he casually mentioned how he always sat on the edge of his bed to pleasure himself, hunched over for 20 to 30 minutes at a time. That was the missing piece. We did an ultrasound and found signs of vascular congestion and reduced penile blood inflow. His posture was the culprit, not his hormones, not his heart, but the way he sat. This type of damage accumulates slowly. What starts as mild numbness turns into incomplete erections. What starts as tingling becomes delayed arousal. Eventually, many men lose the ability to maintain intimacy at all, not because they're too old, but because their pelvic blood flow has been silently cut off for too long. Here's the truth most won't tell you. Sexual vitality depends on pelvic health. If you crush that foundation, everything above it falls apart. The pelvic region needs space, it needs movement, it needs relief from pressure. The fix is simple but powerful. Recline with support, open the hips, avoid long periods of compression. Just like you wouldn't cut off blood to your legs for 30 minutes, don't do it to your most vital organ. You deserve better than to lose sensation and connection simply because of how you sit. A few inches of adjustment could mean years of restored intimacy and function. And trust me, your future self will thank you. But even posture isn't the full story. Because sometimes, the real damage doesn't come from how you sit, or even how you touch. It comes from how often you do it, and the way your body tries to tell you it's had enough. That's where most men go completely blind and pay the price. Let me explain. Secret 4. Overstimulation and frequency. Ignoring the body's natural signals. This one is harder for many men to hear, but I need to say it plainly. Sometimes, the greatest harm isn't in what you do once. It's in what you do over and over again without letting your body recover. I'm talking about overstimulation. Masturbating too frequently, especially without respecting your body's need for rest, quietly chips away at your vascular and sexual health. And by the time you feel the damage, it's already taken hold. I know how it happens. You retire, you spend more time alone, you look for comfort, release, or just something to fill the silence. Masturbation feels like a safe outlet, but without limits, without awareness, it becomes a slow poison. The body after 60 isn't built for the same kind of rapid recovery it had in your 30s. The blood vessels are more fragile, the nervous system more reactive, and the hormonal balance more sensitive to stress. Every time you climax, your body enters a temporary recovery phase, what we call the refractory period. For younger men, this may last minutes, but for older men, it can last hours, even days. And if you push through that window too often, if you ignore your body's natural breaks, you create a constant cycle of overstimulation and inflammation. Blood vessels stay constricted. The penis doesn't receive the oxygen it needs to fully recover. In many cases, this leads to chronic pelvic congestion and nerve fatigue. I've seen men in their 60s and 70s who have slowly lost all sensitivity, not because of disease, but because they pushed themselves too far, too often, for too long. The blood stopped flowing as it should, the nerves dulled, erections weakened, and intimacy became a memory instead of a living experience. What makes this so dangerous is that the damage feels invisible at first. It hides behind the belief that more is better. But what your body needs now is not more stimulation, it's more respect. Every erection requires blood, oxygen, and neurological coordination. If you keep depleting these systems without time to recharge, the damage becomes cumulative and, in some cases, permanent. This isn't about shame, it's about wisdom. Knowing when to stop is just as powerful as knowing how to begin. I often recommend older men reduce their frequency to 2 to 4 times per week, depending on their energy, circulation, and recovery. Give your system a chance to heal. Let your desire return naturally instead of forcing it. The rewards are greater sensitivity, stronger erections, and a renewed connection with your partner, not just physically, but emotionally. Because at the heart of this, Intimacy isn't just about stimulation, it's about presence, awareness, feeling more, not just doing more. If you give your body space to breathe, it will surprise you with what it can still do, no matter your age. Now, you might be wondering, if these habits have already caused harm, is it too late to turn things around? The answer is no. In fact, there are proven, practical strategies that can help restore blood flow, improve sensitivity, and bring life back to areas that feel numb. Let me walk you through what actually works. The path to recovery. How to restore circulation, sensation, and intimacy after 60. I've shared a lot with you today, and if any of it made you pause, even for a moment, then let me assure you, you're not alone, and it's not too late. No matter how long you've lived with these habits, your body still wants to heal. Your blood still wants to flow. Your heart still wants connection. The path to recovery isn't complicated, but it does require intention and a bit of courage to change. Start by shifting how you view self-pleasure. This isn't just a private act, it's part of your health routine now. Use a gentle touch, not out of weakness, but because your circulation depends on it. Lubricate generously as a daily act of care for the skin and blood vessels that support your intimacy. It may feel awkward at first, but I promise you, that one step alone protects more than just your comfort, it preserves function. Then, change how you position yourself. Sit less, recline more, open your hips, create space in your lower body so that the arteries and nerves serving your pelvis can breathe again. Even a small pillow beneath your tailbone can make a major difference. These may sound like small adjustments, but when you add them up, they become the foundation for stronger, longer-lasting erections. Pay close attention to how often you stimulate. Set limits, not to restrict yourself, but to give your body time to replenish. 2 to 4 times a week is a healthy rhythm for most men over 60, and instead of chasing intensity, chase presence. Take your time, slow down, breathe, focus on sensation instead of release. You'll be amazed at how much more fulfilling it becomes when you give your body room to feel again. Beyond technique, nourish your circulation daily. Walk more. Stretch your hips and lower back. Drink more water. Eat foods that support blood vessel health, like beets, berries, spinach, and fatty fish. And don't be afraid to speak to a doctor if you're concerned about blood flow, numbness, or changes in function. Getting support isn't a weakness. It's a sign that you still care about living fully. And above all, forgive yourself. Many of the habits we've talked about today weren't taught to you. You did what you thought was normal, what felt right at the time. But now you know better. Now you get to choose differently. And that choice can restore more than just physical health. It can bring back confidence, connection, and even joy. You're not too old. You're not broken. You're not done. This is your chance to reclaim what matters. And every step you take, every change you make, can help bring more life, more sensation, and more closeness into the years ahead. If you're still watching and ready to start this journey, let me know by typing "I'm ready" in the comments. And remember, sometimes the smallest changes lead to the greatest breakthroughs. This isn't the end, it's the beginning of something much better. If you're ready to take back control, hit subscribe and type "I'm ready" in the comments. Your comeback starts now.